Hello friends, welcome to our next lecture on our first lecture on endocarditis. We are continuing with diseases of heart. So this lecture is about endocarditis. What is first of all what is endocarditis? So as you can see, endocarditis is made from three words: endo plus cardium plus itis. Endo means internal, cardium means heart, and itis means, as you already know, inflammation. So you can see that endocarditis means inflammation of internal heart. What is meaning of internal heart? Internal heart, from internal heart we mean that inner covering or inner layer of heart. So endocardium is inner covering of heart, and its inflammation is called as endocarditis. So there are various types of endocarditis, and almost all types of endocarditis are characterized by verrucae or vegetation. Verrucae means warts. So this is a growth, a type of growth. So all type of endocarditis are marked by a growth which is called as verrucae or vegetation. So now we will look excuse me. Now we will look at classification of endocarditis. So basically there are two major groups in which endocarditis is divided. The first one is non-infective and second one is infective. It is clear from name that non-infective are sterile, that is they are not infected, and then there is second group which is caused by any organism which causes infection. So in non-infective there are three more types. First one is rheumatic endocarditis, second one is atypical verrucous endocarditis, it is also known as Limban-Shanks, and third one is non-bacterial thrombotic endocarditis, which is already known as cachectic and merantic endocarditis. So this is non-infective types. Now infective types. So there are mostly bacterial endocarditis, and then there are other infective types like caused by tuberculous, syphilitic, fungal, viral or rickettsial organisms. So this is a classification of endocarditis. Now we will look at different types of endocarditis one by one. So first one is rheumatic endocarditis. Rheumatic endocarditis is caused due to rheumatic fever. Rheumatic endocarditis is caused by due to rheumatic fever, and rheumatic fever is caused by streptococcal bacteria. What happens is streptococcal bacteria causes sore throat. They infect throat, and if that throat is not treated well, then it may progress to affect heart and will cause a rheumatic fever, and this rheumatic fever will result in rheumatic endocarditis. So first streptococcal throat infection occurs, then rheumatic fever, and then rheumatic endocarditis. Rheumatic endocarditis may affect endocardium of valve or endocardium of heart wall. So rheumatic endocarditis has two components. It may affect endocardium of valve or endocardium of heart wall. So endocardium covers both heart wall and heart wall. So that is why it has two components. So if it affects heart valve, it is called as rheumatic valvulitis, and if it affects heart wall, it is called as mural endocarditis. Okay, clear? Remember these two names, that if it affects heart valve, it will be called as rheumatic valvulitis, and if it affects heart wall, it is called as mural endocarditis. Why mural? We have already seen in previous lectures that mural means wall. Now coming to rheumatic valvulitis. What happens in rheumatic valvulitis is that valve becomes thick, and there are multiple small verrucae or vegetations are formed over valve. As already I have mentioned that verrucae means wart, and the most commonly affected valve is mitral valve. In rheumatic valvulitis, mitral valve is most commonly affected. Next is rheumatic mural endocarditis. In this, what is a characteristic feature is The characteristic feature is that McCallum's patch is seen in heart wall. What is McCallum's patch? It is a map-like area of thickened, roughened and wrinkled part of the endocardium. So, in rheumatic mural endocarditis, the affected area of the endocardium becomes thick, rough and wrinkled, and it gives appearance of a map. So, this is called as McCallum's patch. So, this is rheumatic endocarditis. Now, we will look at second type, that is atypical verrucous endocarditis, also known as Liebman-Sachs endocarditis. Why Liebman-Sachs? Because these were two American physicians which first described this condition. So, their name is given to this condition. It is characterized by sterile, non-infected verrucous vegetations, and it occurs in collagen diseases. This is the characteristic feature, that this type of endocarditis occurs in collagen diseases like acute systemic lupus erythematosus, also known as SLE, systemic sclerosis, thrombocytopenic purpura, TTP, etc. And what is collagen disease? Collagen disease means any disease which is associated with defect in collagen, that is called as collagen disease. So, this type of endocarditis is seen in these collagen diseases. It most commonly occurs on mitral and tricuspid valves, and verrucae are multiple, small and granular. So, this is a typical verrucous endocarditis. Now, we will look at third type, that is non-bacterial thrombotic endocarditis. It is also known as cachectic merantic terminal endocarditis or endocarditis simplex. Why it is called as so, we will look a little further. So, there is formation of sterile platelet and fibrin thrombi on cardiac walls and adjacent endocardium. So, non-bacterial thrombotic endocarditis, as you can see from name, that it is thrombotic endocarditis. So, in this growth or vegetation or wart or verrucae are formed by thrombus, and this thrombus is formed by platelet or and fibrin. Okay, platelet and fibrin form thrombus. This thrombus is formed on cardiac walls and adjacent endocardium. It affects heart wall and the endocardium which is covering this wall. So, these thrombus are formed there, and they look like a growth or wart or verrucae or vegetation. This type of endocarditis is commonly found in following diseases or conditions. So, this type of endocarditis is associated with some condition. What are they? First is in patients having hypercoagulable state due to various causes like cancer, TB, renal failure and chronic sepsis. So, these are conditions in which patient has hypercoagulable state. What is hypercoagulable state? Hypercoagulable state is that in which blood has tendency to form clots. It has tendency to coagulate. So, it will coagulate, it will form clot, it will form thrombus. So, obviously, if there is tendency to form thrombus, then thrombotic endocarditis, that is non-bacterial thrombotic endocarditis, may occur. And it also found in persons having allergy, vitamin C deficiency, deep vein thrombosis and endocardial trauma. So, in this first cause, when you look at cancer, TB, renal failure and chronic sepsis, what happens is that in all these four conditions there is weight loss and weakness of patient. So, the terms for weight loss and weakness are cachectic and merantic. Cachectic means weight loss, merantic means also weight loss and weakness of a particular organ or whole body. So, that is why because all these conditions are associated with weight loss and wasting away of the body. So, this type of endocarditis is also known as cachectic and merantic, and also terminal, because all these conditions have in earlier times they didn't have much treatment. So, most probably patient expired. That is why it is also called as terminal endocarditis. its verrucae are small and brownish, and they may be single or multiple. So this is three types of non-infective endocarditis. In next lecture we will look at infective types of endocarditis. So again, if I hope you have enjoyed this lecture, and if anything is not clear, you can ask in comment section. That is it for today. Thank you. Bye bye.